Yeah, very good morning to everyone. My research, I'm Miss Naphisabet Kharbithai, MSc Nursing student. So, my research topic for today, the research statement is effects of topical application of urea and aloe vera cream on hand-foot syndrome in GI cancer patients receiving adjuvant 5-FU containing chemotherapy, a randomized control trial. So the background of the study, worldwide colorectal cancer is the third most common cancer in men and the second among women. In India, colorectal cancer is the fourth most common cancer in males with an incidence of 7.7% and third most common among females with an incidence of 5.1%. About 330,000 deaths occur due to colorectal cancer worldwide. Fluorouracil remains the most widely used agent for colorectal cancer. Capecitabine is a rationally designed 5-FU prodrug developed to mimic the continuous infusion of 5-FU. Hand-foot syndrome can develop during the treatment with capecitabine or 5-FU. Hand-foot syndrome is also called as palmar-plantar erythrodysesthesia. HFS causes redness, swelling, and pain on the palms of the hands and or on the soles of the feet, and sometimes blisters appear. It can be painful and can affect the daily living. Certain studies have shown that urea-based cream are effective in preventing and reducing the incidence of HFS, but not many studies have been done, especially in India. Urea plays an important role in the preservation of skin hydration and integrity. So to support that, I have two studies. One is Mapicel versus urea cream as prophylaxis of capecitabine associated with hand-foot syndrome, a randomized phase 3 trial of the AIO Quality of Working Group. So this study compares a newly introduced ointment containing several antioxidants and exhibiting high radical protection factor, which has been available on the German market since 2011, with urea cream for prevention of HFS in patients treated with capecitabine. So the results showed that a total of 152 patients were evaluable, and in total, 47 out of 152 patients experienced HFS, and 39.5% with the new ointment, and 22.4 in the urea arm. Which basically shows that in the urea arm, it shows it is lesser in the urea arm. And another effect of urea cream on hand-foot syndrome in patients receiving chemotherapy, a meta-analysis. So the objective of this study was to determine the effectiveness of urea cream and to evaluate the prevention and treatment of HFS. So the results showed that out of in 7 trials involving 1,387 patients in the prophylactic subgroup, the patients with urea cream intervention showed a significantly lower incidence of HFS at the second grade or greater, and a significant lower incidence of any grade of HFS in those receiving the urea cream intervention. So the objectives of my study are, the primary objective is to assess the effectiveness of urea and aloe vera cream on hand-foot syndrome in patients receiving 5-FU containing chemotherapy. The secondary objectives are to assess the number of patients presenting hand-foot syndrome of any grade, and to assess the quality of life related to HFS between participants in the experimental and the control group. The methodology, the research approach is quantitative research design, experimental, sample size 140 population, GI cancer patients sample, GI cancer patients receiving 5-FU containing chemotherapy at TMH and ATRAC, and sampling technique is randomized control. So the criteria are the inclusion criteria, age above 18 years and those with GI cancer, receiving first cycle of adjuvant 5-FU containing chemotherapy, present at the time of data collection, willing to participate and give written consent, patients who can understand Hindi, English, and Marathi. And the exclusion criteria are patients having allergy to urea cream and aloe vera, patients with dermatological conditions that affects the hands or feet, patients receiving targeted therapy, patients receiving radiation therapy. The treatment plan in the experimental arm, the participants randomized in the experimental arm will be given 6 tubes of the urea and aloe vera cream. So a demonstration will be given to them regarding its application. That is, the cream is to be applied 4 times a day for the palms and 2 times a day for the soles on clean palms and soles after washing with warm water. The amount of cream will be 1.5 ml, that is 1/3 of a teaspoon for the palms, and 2.5 ml, that is 2/4 of the teaspoon for the soles, and to be left for 1 to 2 minutes for absorption. And this plan will be implemented for 9 weeks. The participants in the control arm will continue to receive routine standard treatment offered by the doctor, and then the participants in both the groups will be assessed if they have developed HFS of any group using the CTCA grading for objective assessment, and the experiences related to quality of life using HFS 14 scale, which is a subjective assessment at the third, sixth, and ninth week. So this is the HFS 14 scale with 14 questions, and this is the CTCA grading for HFS. So data analysis, descriptive statistics will be used to summarize patients' characteristics from control and treatment groups. Fisher exact test or chi-square test is used to compare to find out any association between the application of urea cream and incidence of any grade hand-foot syndrome. And students' t-test or Mann-Whitney U-test will be used to compare the incidence of moderate to severe HFS in both the arms. A p-value of less than 0.05 will be considered as significant. So the budget plan. So I have found this.
Cross your time. So sum it up.
Okay. So that is all, and so this for my study means the urea and aloe vera cream will be used for the patients for the prevention of the as a prophylaxis treatment in the prevention and reduction in the incidence of HFS in patients receiving 5-FU containing chemotherapy.